Hello, my name is Myra Olvera. I'm a family nurse practitioner student, and today I'm going to be completing a complete head-to-toe assessment on a patient. So I'm going to go ahead and knock, introduce myself. My name is Myra. I'm a nurse practitioner, and I'm going to be doing a complete head-to-toe assessment. Can you tell me your name?
Hector.
You tell me your birthday? April
April
20, 1980.
1980.
Very good. All right, so I'm gonna go ahead and, can I proceed?
Yes.
Okay, perfect, thank you. So I'm gonna go ahead and provide privacy, make sure the door is closed, make sure if there's a curtain, make sure I close that curtain, make sure I wash my hands. And then I'm gonna go ahead and look at his vital signs. I already took his vitals. Temperature 98.7, blood pressure 110/65, heart rate is 76, respiration 17, 99% of air. Height is 5'6" with a weight of 165 pounds. Okay, so the vital signs are within normal limits. Okay, so he's alert oriented. I'm gonna go ahead and check the head, make sure it's symmetrical, look at the contour, look at the course of the hair, make sure there's no lesions. So for what I can see is hemicephalic. Look through there's no lesions, no abnormalities. Perfect. So everything there is intact. Perfect. So I'm gonna go ahead and look at your ears, okay? Any pain?
No.
Perfect. So externally, the ears are intact. Okay, so in order to look inside the ear, I'm going to use my otoscope. For this purpose, I'm going to use my pen as the otoscope. So I'm going to go ahead and look at the ear. Okay, there's no drainage, no fluid. The tympanic membrane is visible, pearly gray. Perfect. We'll go ahead and do the same thing in the other ear. There is no drainage, no fluid, and the tympanic membrane is visible, and it's pearly gray. Perfect. So now I'm going to whisper something in your ear, and you're going to repeat it, okay?
1, 2.
Perfect. And then the other one.
1, 2.
Perfect. So that's intact. So if I had a tuning fork, I would place it right behind the ear, let it ring, and I will ask the patient to let me know when they hear the ringing. And then I will also do the same thing with the tuning fork. I will vibrate, make it ring, and I will ask the patient if they're able to hear that vibration. But for this purpose, I'm just gonna verbalize that. Okay, so now we're gonna look at the eyes. Okay, so the sclera is white, conjunctiva is pink. There's no drainage, there is no fluid. Okay, so you're just gonna look straight ahead, okay? I'm gonna look inside your eye to test for the, to see the reaction of the pupils. Look straight ahead. Perfect. Look straight ahead. Good. Perfect, so they're reactive to light, rounds, about 3+. And I will also look inside to look at the optic disc. Perfect. To look at the anatomical features inside. So everything there is intact. Okay, so now don't move your head and you're gonna follow my finger, okay? Just follow my finger with your eyes. Very good. Okay, follow it with your eyes. Perfect. So there I tested the 6 cardinal signs, which are intact. So cranial 3, 4, and 6 are good on this patient. So now we're going to do this Snellen chart, and we're going to test cranial nerve number 2. So for a patient, it has to be 6 feet apart. Okay, so it'll be 6 feet. Cover one eye for me. Perfect. Read the letters.
P.
L.
L.
What the letter is.
Q.
R, C,
Perfect. Okay, now with the other eye, you do the same thing. What's the letter? Good.
L,
Good.
M, N,
Q,
Q, R,
S.
S.
Perfect. Now with both eyes, can you tell me what the letters are?
I said the S was a C and
It's okay.
P,
Uh-huh.
L, M,
Good. Both eyes, you can uncover them.
U,
Uh-huh.
Q,
Uh-huh.
R, S.
Perfect. So the vision is 20/20 bilaterally. Okay, so perfect. There we go. Okay, so now I'm gonna look at the nose. Okay, I'm gonna make sure his nostrils are patent, there's no drainage fluid, and make sure there's no septum deviation going on. So for what I can see, septum is midline. I'm gonna use my flashlight to look inside the nose, and they're patent and no drainage or fluid coming out the nostrils. And then I would also perform a smell test, so we get a smelly substance, have the patient smell it, and tell me what they would smell for that test. All right, so next I'm gonna look at the mouth. It's pink, moist. The mucous membranes are pink, moist, and intact. All right, so gonna stick out your tongue and say ah. Very good. All right. Now you're gonna move your tongue side to side. Side to side. Very good. Very good. Okay. Make a big smile. Close your eyes. Tight, tight, tight. Very good. Lift up your eyebrows. Good. Lift it up and down, up and down. Very good. Alrighty. So close your eyes and tell me where am I touching? Close your eyes. Good. Where am I touching? Very good. Close your eyes. Where am I touching?
My chin,
Good. And where am I not? Close your eyes. Good. Where am I touching?
my forehead,
Very good. Okay. So you're gonna touch my finger and then you're gonna touch your nose. Touch my finger. Touch your nose. Touch my finger. Touch my finger. Touch your nose. Good. Perfect. Very good. All right. So that's good. All right, buddy. Now we're gonna test your shoulders. Are you able to do this for me? Do this for me. And around. And forward. And forward. Any pain? No? Very good. Thank you. Alright. Very good. Very good. We're done with that. So now we're gonna look at your chest, okay? You've been having a little cough, huh, bud? Yeah? Okay, so now we're gonna listen to the lungs, but first we're gonna do percussion to make sure there's a resonance there, and also palpitations. Okay, so I'm gonna put your fingers and tap for percussion. For percussion. Okay, we're also gonna do it. That was posterior, and we're gonna do it interiorly and laterally. Good, and then we're gonna palpate as we breathe in and out. Good. Okay. Okay, check for crepitus. Okay, perfect. Now we're gonna listen to your lungs, okay? Take a deep breath. In and out. Good. In and out. Okay. In and out. And in and out. Perfect. In and out, buddy. Good. In and out. Perfect. So there is some respiratory wheezes going on there. So it looks like Buddy gonna need some little breathing treatment, okay? Okay, so now we're gonna go and listen to the heart. So we're gonna listen to 5 spots. You have the aortic, pulmonic, herbs, tricuspid, and a mitral valve there. And then the PMI will be the fifth intercostal space, submacular, okay? So we're gonna go ahead and listen to the heart. Perfect. So S1, S2, normal heart sounds. I heard no murmurs. There's no gallops. And then also for when we assess the heart, we're also gonna do percussion and palpitation, also to check for the resonance on there, and also to check to make sure there's no crepitus. Alright, so now we're gonna go ahead and test all the lymph nodes behind the ear and submandibular, and also test some sinuses. Alright, so let me know if you have any pain. Any pain here? Pain there? No? And then we're gonna do the cervical lymph nodes. No? Perfect. Submandibular. No? Perfect. And then we'll also do a temporal pain. Also check the sinuses. Any pain? Any pain? No? Any pain? Say no. Pain there?
No.
Perfect.
My ear hurts.
Ear hurts? Okay. Okay, so we're gonna go ahead and check your reflexes, okay? Gonna check the brachial reflexes. Very good. Check the other brachial. And also check the other. Very good. Alright, buddy. So we're gonna go ahead and extend your feet, and we're gonna check your popliteal here. Perfect. Also check the heel, where is the Achilles. Perfect. Alright, buddy. Good job. Now we're gonna go ahead and do his abdominal area. Alright, go ahead and lay back for me, bud. Very good. So we're gonna do the percussion, all four quadrants. Make sure it's tympanic. Let me know if you have any pain, okay? Alright, and then we're gonna go ahead and palpate, and of course we're gonna feel the tail of the liver, and of course we're gonna feel if it's enlarged as well. Let me know if you have any pain, okay? Any pain? No? Pain? No? Pain? Alright, and it looks flat and round, and it's non-distended. And then go ahead and listen to his stomach. No more reactive bowel sounds there. Everything's intact. And then in this position, I will also check the inguinal lymph nodes and the femoral lymph nodes as well to check for any swelling that might occur there. All right, if he would have had some tenderness in the right lower quadrant, and that would be concerning for appendicitis. But in his case, he is within normal limits. All right, but go ahead and get it. Perfect. All right, so we're gonna go ahead and test his muscular range of motion on his upper extremities. Any pain?
No.
Pain?
No.
Pain?
No.
Perfect. So we just checked his upper arm, his elbow. Now we're gonna check any pain, his wrist. Perfect. And then we're gonna go ahead and let me know if you have any pain. No? Any pain?
No.
No? Perfect. Elbow, any pain?
No.
Any pain?
No.
No? Perfect. Can you squeeze my fingers with both hands? Squeeze, squeeze, squeeze. Perfect. So 5 out of 5 in the strength. Upper extremities are good. Okay, you're done there. Good, thank you. And then we're gonna go ahead and lay back for me, buddy. We're gonna go ahead and check the hips. Let me know if you have any pain, okay? Any pain? Any pain? 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 Checking the knee. Pain? No? Perfect. We're gonna go ahead and do the same with the other leg. Pain? Pain? Any pain? No? Knee. Any pain? Perfect. Any pain? Okay, let me check this one. Any pain? Good job. Nope. Alright, so we're gonna go ahead and test his feet range of motion. Alright, push down with one leg. Good. Push up. Very good. Ah, excellent. So his lower extremity strength is 5 out of 5. Alright, buddy. Now we're gonna check your pulses, okay? So we're gonna check the brachial pulse. 3+ strong. 3+ strong. Check his capillary refill. Perfect. It's less than 2 seconds. And also we're going to check his popliteal and his dorsally pedis pulses as well. 3+. Very good. We will also check for edema, and there is no edema on either upper or lower extremities. And we will also remove the socks and do the cap refill on the lower toes, which is less than 2. Okay, and then next we will check his skin. So his skin is appropriate for ethnicities. There's no skin tears. There is no discolorations. There's no moles that are irregular border. So ethnicity and his touch is warm and intact. All right, and now I'll have him stand up for me on the floor, please. All right, bend and touch your toes. Perfect. So I will test the range of motion of the spine. Make sure it's nice and even. Very good, bud. All right, so I'm gonna have you now, another test. Okay, please stand up. Perfect. So you're gonna walk back, walk. No, you're gonna walk forward, buddy. Very good. Walk and then walk back to me, please. Walk back to me. Very good, steady gait. And now you're gonna walk on your heels. Walk on your heels. Very good. Very good. Very good, and then come back and walk on your toes. Walk on your toes. Excellent job. Perfect, bud. All right, so that completes our complete head to toe assessment. Thank you so much. Do you have any questions or concerns?
No.
No? Okay, perfect. So I will go ahead and say my goodbye, and I will wash my hands and exit the room.